watching Fiji Today. Public health and pharmacy personnel will be going through an orientation program on the newly acquired anti-TB medicines funded by the Global Drug Facility. With the purchasing of the new GDF kits, patients will now take 4 tablets instead of 11.
The National TB program in having the orientation program will assist in improving the mechanism for the procurement and supply management of anti-TB and accessory medicines used in the treatment of TB. Currently, through the NTP's directly observed treatment, short course centers or single-dose formulations are used in the treatment of TB patients. The rationales for recommending the 4-drug fixed drug combination is that it simplifies both treatment and management of drug supply and may prevent the emergence of drug resistance.
This is very significant in the national TB program in Fiji, because for the first time we now have a better and safer way to deliver our drugs, or drugs for our patients to take. 4 drugs are combined into 1 tablet. That's a big improvement over the loose drugs that patients used to take in the past, say 11 tablets a day, compared to now, say 2, 3 or 4 tablets, depending on their weight.
The 4-drug fixed dose combination may increase compliance with the treatment because most tuberculosis patients need to take only 3 to 4 tablets per day during the intensive phase of treatment instead of the 15 to 16 tablets per day that is commonly the case with single drug formulations. Dr. Underwood says in the past the Ministry of Health will source drugs from a wide range of distributors, which leads to delays of drugs arriving into the country and can affect treatment for patients.
Also, the drugs now come in a kit, so patients take their kits home with them when they are discharged to complete treatment in the community. There's no problem with shortage of drugs, drugs not reaching them. So it's also very, very good for patients. It means that it's easier for them to finish their treatment. The chances of being cured are much better. It's easier for health professionals as well. The logistics of moving the drugs around is much more simplified. In terms of government procuring the medications, the drugs all come from one distributor, which is the Global Drug Facility.
The World Health Organization supports the use of the 4-drug fixed dose combination and has included the constituent drugs in the model list of essential drugs. This is based on the solid evidence that short-course chemotherapy is most effective and is assumed as the single drug formulations.
The International Day for Eradicating Poverty has been observed annually since 1992. In Fiji, the event was held in 3 centers, Levuka, Nambawalu and Rakiraki.
International Day for Eradicating Poverty is an observance that presents an opportunity to acknowledge the efforts and struggle of people living in poverty. The theme for this year is From Poverty to Sustainability.
The state, under its commitment and obligation to achieving the first Millennium Development Goal, eradicate extreme poverty and hunger, has incorporated it through its policy objective of reducing poverty to a negligible level by 2015. And this is also well articulated in the People's Charter for Change, Peace and Progress, and the Roadmap to Democracy and Sustainable Socio-Economic Development from 2009 to 2014.
Government is committed to achieving the MDG by reducing poverty to a negligible level by 2014.
Encompassed in the framework are the Integrated National Poverty Eradication Program, the Rural and Outer Island Program Development, the ROI. In addition, government has also included poverty eradication strategies in other government ministries' programs with a focus of achieving its vision of reducing poverty to a negligible level by 2015. These programs include growing the economy and improvement of food security, increasing of basic social services such as health, education, housing, improving participation, empowerment, providing equal opportunity, and skills development.
Services are also targeted for the disadvantaged. The state continues to embark on major reforms to empower people in working out of poverty in Fiji.
Fiji has the potential to be one of the world's providers of niche products, says Attorney General and Minister for Trade Aiyaz Sayed-Khaiyum. Speaking at the first ever Fiji-Korea Business Forum held last week, the minister said the historic meet shows government's commitment towards further strengthening its Look North policy.
Fiji has the potential to further market its unique blend of products. Speaking at the Fiji-Korea Business Catalogue exhibition, the Attorney General and Minister for Trade Aiyaz Sayed-Khaiyum says the interest on trading with Fiji and buying Fijian-made products presents opportunities for further marketing Fiji-made products overseas.
Fiji, we are trying to position Fiji also as a market where you get niche products, whether it's water, whether it's fruit, whether it's organic farming, whether it's a particular type of sea product. We realize we cannot carry out mass production in Fiji, but we have many locally grown, locally produced and even locally manufactured items that are targeting the niche market.
Given Fiji's strategic location in the Pacific, he said government is adamant on strengthening the development of business relationships.
So as far as the Bainimarama government's objective in terms of looking north, as we say, is being continuously fulfilled on a daily basis. The Korean investment levels in the Fijian trade obviously has been somewhat on par, and that there's enormous opportunities to expand that.
Korean business people need to work harder to develop unexploited markets in Fiji and the Pacific countries.
The event marks a new chapter in the partnership between the two countries.
Join us again after the break.